watching us from this evening. What a brilliant evening that we are having here. Time to invite you once again to the show, and this is all about the PCEA Health Week 2024. The theme being coming back to senses, and of course facing alcoholism. Coming back to senses, facing alcoholism. That is the theme of PCEA Health Week 2024. And as well as CAC TV, as partners, we're here to help out, inform you the importance of this topic, alcoholism. My name is Vincent Kirosi. I welcome you aboard. Of course, I have panelists that I will love to introduce to the show, but I have to inform you that we are live from PCEA Tumutumu Hospital, our partners, of course, and they are going to be in handy to help us understand one or two things to do with alcoholism and population growth. That is what we're going to talk about tonight. But before we delve deeper into this, I want to introduce my panelists. To my close left is Alice Wanjiro Gidenji, who is a Chief Nursing Officer at PCEA Tumutumu Hospital. Karibu sana. And right next to her is Dr. John Kagudi, the Acting Chief Medical Officer, also a consultant family physician at PCEA Tumutumu Hospital. Karibu sana, sir.
Thank you so much, Vincent.
Good.
Karibu sana PCEA Tumutumu.
Thank you. And of course, we have a Rev in the house, Reverend Simon Munuhe Maina, the hospital chaplain.
You are most welcome.
Thank you.
Yeah.
Karibu sana. And I just want, before we begin, to just do a preamble here. And this, 4 months ago, alcoholism was actually described by the government of Kenya as a national security threat. And to put it in words, this is what the cabinet minister or the cabinet secretary, national security, said that the level of trade, consumption of drug and alcoholism in the country is a national security threat, putting it in line with banditry and terrorism. I just want to ask a general question. How bad is the situation of alcoholism in the country? Maybe to begin with you, the nurse.
Okay, the alcoholism in the country, the level is very high because you are seeing so many people involved, especially the young people. So, to be honest, I concur with what the government have seen it as a threat to the Kenyan society.
All right.
Yes.
What is your opinion here, Dr.
That's a very true conclusion. As Sister Alice has also mentioned, the burden falls even on the young. And as we'll be talking about population and alcoholism, population growth and alcoholism, then it is paramount that the population that is affected mainly by these alcohol issues is the young and productive. Then where are we headed as a nation? Do we have a future in terms of not just the numbers, but the numbers that matter? Not just quantity, but what quality of the persons and leaders do we have? If they are all of them embroiled in alcoholism, which also goes hand in hand with drug abuse.
Mm-hmm. So it's truly a threat.
It is truly indeed a threat.
Reverend, I mean, you deal with people socially. How bad is the situation? And do you concur with what the Ministry of Interior said here?
I would concur with my friends.
Yeah, maybe you try to put your mic close to your...
that the drug, the alcoholism is at an alarming level, whereby it has destroyed our children. Not only our children, but even the parents. Many families are breaking. The young generations are not productive in their works because at the time they start drinking very early in the morning. So it is a great danger, and if it is not checked or measures taken immediately, I think we are losing this nation.
Well, I don't know what your take is. Remember that you can get in touch on social media pages, CACTV Kenya on Facebook, CACTV_Kenya on X, formerly Twitter. And of course, our SMS number is 0311220044. We'll try to sample in what you say and what your take is, but in the whole topic of alcoholism and population growth. Now, before we go as far as we want to go, Dr. maybe you help us understand in fewer words what alcoholism really is, for people who don't understand.
Thank you, Vincent. Just to put it in very short, few words.
Yeah.
Alcoholism was the previous terminologies that you used to know it. Currently, the WHO or the World Health Organization classifies it as alcohol use disorder.
Okay.
And it's a level of utilization or consumption of alcohol or alcohol-related products that makes someone dependent on the same, whereby their functioning, be it physical functioning, mental functioning, every other factor in their system is focused on getting a drink in the next few minutes, the next few hours, to the point where someone is now gauged to be an alcoholic. Failure to which they develop what we call an alcohol withdrawal syndrome. That is on the extreme end of the alcoholic spectrum.
What is alcohol withdrawal syndrome?
Alcohol withdrawal syndrome is a spectrum of signs and symptoms that manifests when a person who has been so much into alcohol, both in quantity and in time, where the body now must. It's not that the person that it cannot do without. So, ushasikia asubuhi some people say ameenda kutoa lock.
Okay.
All right. Kutoa lock is one of the signs that someone is having an alcohol withdrawal. There are several others as we analyze any patient or any person who could be involved in the alcoholism. But nonetheless, it is a condition that can be managed when there is the right support, the right structures, right strategies, policies, and I think by the end of the discussion, Vincent, we'll be looking into then how do we turn around this whole issue about alcoholism, factoring that our young people are the ones at risk and most hit by this, can I say, pandemic?
Yeah, it's a menace. For sure.
It's a menace.
We have to find a way out.
Yes.
And maybe just to bring it closer home, nurse, you deal with cases every single day, I believe.
Yes.
How bad is the situation from how you look at it, from the people who come to you, from the patients that you handle every single day? How bad is the situation locally where you are?
Okay, I would say it's challenging because we are having now, previously, alcohol was being taken by men. But these days, it's even taken by women. And we're having scenarios that even people don't take care of even the unborn children. And we're having scenarios that somebody is pregnant, comes and is an alcoholic, which is very pathetic because that now affects two kinds of life. And now, especially when we say in the central province, the number of alcoholics is rising by day. And not a single day we spend that, and every day, in fact, almost every day, we have admissions for somebody coming with an illness related to alcohol. So it's that bad. And in fact, if you look at the age which is more affected, I say it is the young age, the more productive age group. And you can imagine somebody who is pregnant and the effect the alcohol that will do to the unborn baby. Yes.
So it's a dire situation.
It's a dire situation.
From the look of things.
Yes.
How many cases do you at least there's a case a day?
At least there's a case a day.
And Daktari, that is serious.
Yes.
That is serious because
Yes,
that means if there is a case a day, those are 7 cases at least a week.
Yeah.
And it's only in this hospital. How many hospitals, how many facilities do you have around the country?
And Vincent, if you're to look at it as those that get admitted because of they have blacked out or they're gone to the levels of low blood sugars to the point whereby they've been found on the corridors or next to the road, drunk out dead. We also don't remember that the accidents that are happening because the driver behind the steering was totally out. So that may land in the surgical unit with a fracture, but the genesis of the problem was the alcohol level. All right. And as I'm happy that Sister Alice has brought this, when even pregnant ladies or women overdo alcohol, and that has a direct impact on the maturity and growth of the brain of that child, the so-called fetal alcohol syndrome, it will definitely directly impact on the life and longevity of that child after birth.
Reverend, you are the one close to the social life of people here, and I know maybe one or two in cases have come to you. Have you really met such cases until you ask yourself what is happening?
I have met several cases.
Maybe you help us to understand what is the demographic in terms of age.
This young generation, when they take the drug, the alcohols, when they fail to get the money, they decided to take anything they can get on the way, whether it is another person's property. I was living in a certain area where I was disturbed by the alcohol, mostly the alcoholics, probably even the drug addicts. Or when you cultivate bananas at night, you see they have been taken because they wanted to get the alcohol. So I think it is also affecting even our economy in a way.
Big time.
Because it will make you feel you cannot continue doing that work. You feel frustrated. And I think the economy is very, very much being affected.
Big time.
Because of even in many homes, that person can come, whether there was kept something for the family, probably in form of money, they can take and go and drink. At times you meet them sleeping on the roads. So I still, my opinion is that if Kenya can decide to make alcohol as a great danger in Kenya, and probably stop selling alcohol, I think it can help the future. And not only the future, even the present generation and also the future generation.
What is to come. And I want us now to bring this down to what we are talking about tonight, and it's all about population growth. How then does alcohol consumption, abuse, use, or otherwise affect our population? And before we go there, we were having a chat right before we went live on air with the Terry, with Sister, and with Rev. And we are looking at who is exactly affected, who is mostly affected when it comes to alcohol consumption. And these are cases that you people handle. Is it the female who are affected more? Is it the male? Is it young boys and girls? Who is really majorly affected in this, sister?
Okay, without me going to the specific age, like now we are seeing scenarios that people from secondary school, those are usually between 15 years
and say 20
and 20 years, people who are in colleges and universities. In fact, those are badly hit. And now, then those people who left university, who leaves university, who are jobless. So you can say maybe below 50 years. Below 50 years are majorly affected. But of course, the number of male is higher than the female. But the number of females is growing by day.
It's growing. Now, let me give you figures that I have here, and we try to find a connotation. If there is a relationship between alcohol use and the population that we have. And I want to use the KNBS statistics 2019. That was the census 2019, and see what we have here. And I'm going to bring this closer home to Central Region and look at the counties that we have here. In Murang'a County, the male versus female, the number is male are 523,940, female are 532,669. You see a difference of around 10,000 there. between male and female. The female number is high, of course. Kiambu County, male are 1,197,146, female 1,200,030,454. So a difference of around more than 200,000 there. We go to Nyeri, where we are today. The number is 374,288 male, vis-a-vis the female who are 300,084. 885, a difference of around 10,000 or so there as well. Meru County, male 767, 698, female 777, 975, a difference of 10 as well. Nyandarua 315, 022, this is male, female 323, 247. You can still see that there is a connotation, and there is kind of a pattern of a female number being higher here. Kirinyaga County 302 male, female 308 as well. The number is high. Embu County, interesting, it seems the equal 304, 208, and female 304, 367. Well, a discrepancy kidogo sana. Tharaka Nithi 193, 764 male, and female 199, 406. So what we are seeing is a pattern that the number of female are higher than the number of male. And the doctor, you told me at birth boy child wanazaliwa wengi. But what happens?
Yes. The boy child is blessed at birth. There's a natural attrition that happens. And I think, now that talking about alcoholism, we are not going to blame everything, the reduction to alcohol. And let's just say during the growth and development, maturity to the point where we're becoming adults, we probably going to see the decrease and attrition in the male gender. I think we may know few reasons here and there. I mean, it's the boy child that's the breadwinner sometimes, most of the times, being told, be a man.
The pressure.
Means that you have to do whatever is necessary to provide for yourself, to, make sure your family. So it's the man or the boy child out there that's doing the risky works. They're the ones that are going to be out in the nights. So when injuries, accidents, occurrences that maybe the family is safe, but the man is out there. I mean, there is a lot of reasons why the numbers do eventually decrease. But on the aspect of the alcohol and in terms of population, yes, there's a direct link. All right, albeit in a small way. But when it comes to the alcoholism or alcohol use disorder, it directly reduces the fertility of an individual, especially talking about the boy child now. All right, so may end up having an erectile dysfunction, and even the very essence of life in terms of ability to fertilize also becomes lowered. Impotency. All right, and this in one way or another may contribute to the population reduction. I think in the past and the several decades you have seen in the news and wives going all the way on the roads and said, hey, this club must be closed. Why? Because our men have become married to that club. They don't come to us no longer. So it's like that addiction, and the key is addiction, Vincent. You're talking about the main theories is that they become hooked. Alcohol is just what you call a hook. And once they get in that trajectory, everything else is now geared towards satisfying, gratifying that addiction. And that's why they forget everything else. And you see, it's a vicious cycle. You'll get today, tomorrow you want to be there, and the moment you are hooked, every single coin you earn, you'll be looking for the next minute you'll go to, to increase that level of alcohol blood levels within the system. Eventually, they will have to look for money to satisfy the same. So they go and steal. Oh, yep. use of other drugs that comes together with alcohol, of course, and the height of it all shows them that they can take a ride and cruise all the way from Nairobi to Isiolo within 2 hours. So what happens? They just reach here at Nyeri. It happened over the weekends. Just this Sunday, a young group of boys and girls cruised from Nairobi with a Noah only to reach here at Karatina and roll over. And they were all alcohol intoxicated. Of course, the boys were more than the girls, but it's the ability or, you to make a conscious decision is actually always lowered or diminished when there's alcohol involved.
Exactly. So what I'm taking away from what you said is that, as much as alcohol could not be the major contributing factor to what we see in these numbers, but it's a reason. It's a factor somewhat. And you say that the effect alcohol has on the ability of a man to sire,
Yes.
it's major here. And we've seen, especially in the central region, we've seen wamama wakiinua matawi kwenda barabarani wakisema hatuwezi endelea hivi. You see, we've seen that. So that is one major effect on alcohol on population. Infertility, impotence, inability to bring forth. What is one other way you see that alcohol has impacted population growth?
Okay, I was now looking at the policies which are being made, so that some money is allocated for rehabilitation for those people who are alcoholic. And I look at a scenario that money could have been used in preventive measures like buying vaccines. And because we are going to primary health care, those vaccines reduce the number of mortality of young people.
Yes.
But now it's being allocated for alcoholism, for rehabilitation.
Yeah.
So in a way, it is also affecting the population. Look at these people. If somebody is like Dr. Kagudi has said, is the one who is supposed to be a breadwinner in the family, now gets money, takes all the money to alcoholism.
Yes.
So that family obviously expect the level of nutritional status to be very low. And majorly most of the people who are affected are the young people. What do you expect? Mortality. So when we have such kind of unsecond, although what Dr. Kagudi has said, so all those factors sincerely affect the population of Kenya, the growth of the population in a very big way.
In a big way. I want to bring Reverend. Of course, neno linasema kwenye Biblia kwamba Mungu aliumba Adamu na Hawa akawapatia uwezo wa kufanya nini? Kujaza ulimwengu. That is what the Bible says, and that is essentially what human beings should do. But when you see this happening, how do you feel as a pastor who has the responsibility of ensuring that the flock is living and doing according to the word of God, and also ensuring that there is a generation of tomorrow? But then you see that men and even women now have neglected their matrimonial duties because of one thing called pombe, na pombe ya haramu ambayo imejaa sana vijijini kwetu. How do you feel?
Nianze na vile unasema pombe ya haramu. Nafikiri imeaffect kila mmoja katika boma, kwa kule watu wanakunywa, sababu pengine kijana yule, niseme niko na vijana wakubwa, ingawa hawakunywi pombe, lakini kama wanakunywa pombe, badala wajisaidie, wajisaidie. Sasa itabidi mimi kuwa nabeba mzigo wao,
kuwasaidia wewe sasa,
hata maisha yangu ya nyuma.
Exactly.
Hawanisaidii, mimi nawasaidia. Kile napata na pengine hakuna jambo wanafanya la kujiletea faida ama kuleta faida kwa familia. So naona hata the older generation inaweza kuisha haraka sana, iwe affected na mambo haya ya pombe. ya pili ni mambo ya finance. Huyu mtu ni mzima, chochote anachopata anakimbia kwa pombe. Mwisho anakaa na ufukara, so hata kujisaidia katika maisha hata inayoenda tabugusa tu maisha ya huyo mtu, sababu tumezika wengi unakuta akimekaa katika hali tu ya kunywa mapombe chochote anachopata, hata hawezi kujinunulia, ananunua na mzazi. Nafikiri na affect watu na njia nyingi. So still, as I said in the beginning, the alcohol is a national danger. The fire we have gone, we can say that it is a great danger in this country. And unless we take quick steps, immediate steps, we might find Kenya in, probably I to talk about Kenya, we might find Kenya in a lot of chaos, a lot of problems.
Yeah, and I want us, Doctor, to connect this with what Revel is saying about young people. The focus now is sherehe, and they just want to enjoy today. They don't think much about tomorrow, and this has gone deeper now to affect even their understanding of the social life. They don't want to marry anymore, or they are so engrossed into what they are doing today, into raha and alcohol, until they have forgotten that they need to marry and settle down into families. And when you are not in a position to even think right that you need to get into a family and settle down, then we surely know that the birth rate will go low because watu hawawani. And that is it. So I want us to look at this, how it is a contributing factor as well.
I think you've just said it, Vincent. Like the priorities change when you bring another competitor here. So family is no longer priority to this young person. Gratifying, the addiction is their first and foremost priority. So I find now person is in their 40s, and as Reverend, as I said, they're still living in their mom's house, right? And they have no much hurry. As long as they can go do some little bit of work, get high, and come and sleep. Procreation has become also under threat now, right? That family unit, family concept has been put under siege when it comes to alcohol issues. And when you look even at the older population, I'm sure this would probably be mentioned elsewhere. If you look at any disease that could affect our human body, and you add alcohol to it, all right, it makes it worse. So as much as we see around the mountain, we have a lot of non-communicable diseases and cancers. If you add alcohol to it, it skyrockets. All right. So the diabetes gets worse with alcohol. If it's hypertension, it gets bad with alcohol use. If it is cancers, they get with alcohol. So the longevity again becomes even worse. So it's like you're adding insult to injury. Alcohol just comes now to put the last nail on the coffin for these people. So it's such a cycle that needs to be stopped at one point, because if already you're under threat because of one predisposition to some conditions, and then you just allow alcoholism to just come and carry it over, then it means you have no chance of survival when it comes to handling the two conditions or the three conditions that may be there. And more so, it's known when someone is introduced to alcoholism when they are young, chances are they are going to leave the very high. So studies were done. If someone tasted alcohol before they were age 15, compared to someone who tasted alcohol from the age of maybe 20, 25, all right, the 15-year-old likely to stay with alcoholism and get the whole addiction spectrum compared to the one who started a little bit later. So as this was mentioned earlier on, I mean, it's time now to think about how can we curb this even at our school-going children, because they're exposed to this one when they're still in school, amongst other addiction molecules that we know out there. It's really it should be a national debate.
Yeah,
and I think it has been.
Yeah.
But are we putting the right policies? Not just putting heavy taxes to alcohol. I mean, you remember one time, I think some group went to take alcohol, and I think it was adulterated alcohol. And they didn't know they were going blind. And do you know what they were saying as they were going blind? Doesn't matter even if you put off the lights, you still continue to drink alcohol, not knowing it was the alteration that was actually making them blind. And this has happened so many times. The deaths that emanate directly from alcohol is actually very high. Very, very high. And
Yes.
the other secondary issues that may occur because of alcohol use.
Yeah. Because in a moment we are going to look at now what is the way forward. But before then, sister, can you help us understand? We've talked about people now, priorities change, and young men don't see marriage as a priority. But what about the ability to keep a family? You're married, yes, but you can't keep a family anymore because you are an alcoholic. Broken families, for that matter.
That's great. In fact, I was waiting for that question because we are also having a trend of gender-based violence, which is now coming up very strongly. And it's only that I don't have the statistic here because we screen for gender-based violence. And most of the cases that lead to gender-based violence is due to alcohol. And you have seen a scenario that, especially for, sometimes we think that alcohol is for the poor. But now even the upper class is taking alcohol. And you have seen scenarios these days that somebody does not want to get married. And if they just want to get one child, and that is the end of it. Because they don't want to involve themselves in marriages which break. And if you look at a statistic, most of the marriages that break is due to gender-based violence. And most of them, what causes it? It's alcoholism. So by extension, there is something which is happening. And in fact, like now, if I decide to get only one child because I don't want to get married, what does it take? If all of us, I have one child, in fact, even the statistics or if you do the census, the number will remain the same. The same. So in one way, it is affecting that way. So on the other side, which I don't also it to be left out.
Yeah, please.
Look at now somebody who has taken alcohol. Decision making is altered. And that's why you're having increase on sexually transmitted infections, the HIV. And some of the people who are HIV positive, because they don't want to give birth to HIV, even if we have mechanisms that people you can be positive and don't give birth to a positive child. But there's the notion and the belief that in the society that when you are positive, you can always give birth to a positive child. So what will happen? Somebody becomes positive and says they are not going to give birth. So it's a vicious cycle. It goes loud and comes back.
Unfortunately.
Yes.
Yeah. Now, even as we now get to conclude on this issue, I'd like to understand that what can we give as solutions, or what we think should be done for these at least to be curbed or reduced to some other extent. And I want to bring in Rev. Rev, what do you think the church needs to do? Because that is your forte, that is what you represent.
Let me say that the church, we have many problems. Because when you talk about alcohol, it's not good. The young generation is feeling as if you are not on the right track.
Watahepa kanisa.
So, but still, the Bible says that we should keep on advising our children, whether they listen or not listen, but we should keep on advising them.
Yes.
And I also think when people keep on being told that this is wrong, this is wrong, this is wrong, unless they become addicts to a level that they cannot change. But I still believe as I was young, I was a drunkard. Alcohol taking, drugs, alcohol.
How did you change yourself?
So through salvation. Okay. When I realized about Jesus Christ, I said, from today onwards, I will not be taking alcohol, I will not be taking cigarettes, I will not be taking opium. I made a firm decision up to this moment for probably over 45 years.
Was it easy?
Yeah.
Was it easy to transit from who
it
you
was
are?
not all that easy. And I believe it needs even the grace of God, and also to make a firm decision whether I find it somewhere or not. I will not take it. It is not all that easy. Currently, I'm trying to stop drinking sugar, but it is also it is not easy. Mpaka najua na mtu mwingine unachukua kidogo unawasa kidogo na mimi nataka kuacha
mara moja.
So it is not that easy, but I believe if a person make a firm decision within time, that person will change.
So for you feel the church should continue to advocate for change and try to talk to the affected society and just speak to them, and eventually they'll heed to the word.
About 30 minutes ago, I was having people here to the motion. A young gentleman died in a quarry mine. A quarry in a bomoka. Ikamuua. Na nikiangalia wale walikuwepo naona wengi wao wanakaa pobe tu. Mapobe na pengine na drugs. Nikawa nawaambia hivi vitu hivi vya kutuharibu na kuharibia maisha yako so I was urging them, let us just take what is necessary, if it is the food, the drinks, the tea, the sodas, and whatever. And I think some people will shame, but I also think that, as I have been saying, the government needs to do more. Something. Na nikafikiria hata pengine ni afadhali hata ipo. Sioni kama inaleta faida na inamaliza watu. Ni faida gani tunapata? Hata afadhali tukae katika, in fact niko na familia basi kama pengine chipo vibaya na wengine. Wazazi wao walikuwa wanauza mapombe. Na kuna moja nakumbuka walikuwa kama vijana 7. Sasa wamebaki 2 tu. Wengine wamekufa na hilo. Sasa unaona hata yule mzazi aliwazaa sasa watoto wake wamejikiza mkono. I think we can change.
Unfortunate, right? Unfortunate. Daktari, the government right now, we know that there is a deliberate fight by the government against illicit brews, especially in the central and other regions, led by the Deputy President, Rigathi Gachagua, who has a docket. That's what they are doing, and we know the taxing. We know there was a proposal the other day to increase alcoholic tax to around 80%. Do you feel that this is heading to the right direction, or more needs to be done?
Vincent, I think you're right in the aspect of what has been done, what is being advocated for, and I think I really hail the current measures that are there to try to at least to curb, albeit reduce, because the most we can do at the moment is talk about how can we reduce this rate of alcoholism and the illicit brews that's rampant everywhere. To me, it all goes back advocating for a healthy lifestyle, away from a young age, from preventive, promotive. Because when you start getting the impact now at the end, where you have to do the rehabilitation of persons that have been so much into alcoholism, then you are almost losing the battle here. The thing is that we have a surge of an attempt to cut down on dens that are doing illicit brews. But again, comes like a wave. You know how things always 1-2 weeks, then you're back again to where we began. You have a 6-month spell where everyone is doing their stuff, and then there's some, like 2 or 3 people die and then again you're up in arms and so forth. So like the society, what we need to have a different approach to the issues when it comes to alcohol. I'm touched by what Reverend has said about a family where out of 7, only 2 are remaining. Literally, you can learn from your next brother what happened. But again, once you get to that addiction, what mechanisms exist in terms of helping those that may want to come out of addiction for alcohol, and yet rehabilitation centers are not that common. And if they are available, then they become very expensive for rehab for 3 or 4 months to be able to be taken through the addiction eradication phase. So I think as we look at how we put policies on illicit brews and how we can cut down on dens, and we must look at this other side. How do we then rehabilitate the large population that would wish to come out of it by setting out important structures in our community where they can go seek help, they can get the right psychological and psycho-emotional support to be able to come out of it and live a more better life within the society. They can be rehabilitated back into their families, and we will find they are going to be more useful in that way.
Do you feel, Daktari, sister, that the society is too condemning as well to our fellows who find themselves in this? Because wengine si kupenda kwao, wengine wako willing kabisa kujiondoa, but they're so engrossed into it, say they need help. But do you feel that the society is too condemning, too stigmatizing, and what needs to be done from your point of view?
Okay, what I think we have a lot to pray from family units, and also at the church also to come in, because a character starts from somewhere. Because somebody becomes an addict, it starts from somewhere. And I was talking to a group of people at church somewhere. I'm telling you that this time is the time that the church will have programs for parenting, because all of us became very busy and we don't have time for our children, so that we can be able to mentor and supervise what is happening in our homes. Because some of these drinking habits starts in our home because you are never there. A child comes, is in primary school, has a small room, he stays. The mother comes at night, very busy like me. Like yesterday, I went home at around 9, so I don't even have time to supervise. Who supervises this child is the house girl. If this house girl is a drunkard, what do you expect? And I usually say, when the students are coming into this world, they come like blank computers, the hardware. Who puts the software? It is us, the parents. And unless these people have given programs on parenting, because parenting has been left out, and in fact it has been left out now, being delegated to teachers. So if this house girl has bad morals, what is the kind of software he is going to put in your child? If he is an alcoholic, you put a software of an alcoholic. By the time the parents realize the person is a full-grown alcoholism. Like now, they are also denying, also running away from our responsibilities. And that's why, and I'm not saying that what you call them, boarding schools are bad. A child of standard 3 is usually taken to the boarding schools. Those are the ages that they pick character. By the time they are leaving the primary school, they have all the characters, and we run away from the responsibilities. So when this boy comes and goes back to school, you have not been able to supervise. So I would urge that if the church can have programs for parenting, so that you can be able to guide the young and also even the old parents, so that we can be able to nurture these children from the word go when they are brought into this world. Otherwise, if you leave it majorly on the government, you'll be treating a problem, but you're not treating the root. The roots.
Of course.
Yeah.
Bila shaka. And I love it. I don't want to add anything. But again, I want to include that people learn from example, especially at the young age. So kile mzazi anafanya pia akishe kwamba mtoto wake atakisoma.
Monkey see, monkey do.
Exactly, that is it. So mchungaji, wewe kazi yako unahubiri vijana, unaambia vijana wasiogope kuoa pia. Maana unajua wasiogope kuoa na kuolewa, ndio tusipunguze wingi wa watu katika taifa la Kenya.
The problem is that their bodies are most of them are already destroyed.
Oh my God.
So even when they marry, they live in a crisis.
Oh my God.
So, by final word, I would say that Kenya should declare all types of drug, hata kuongeza bei haitusaidia. Wanaongeza, wanatengeneza kingine
Na bei ya chini.
bei ya chini, hata kabaya sana kanamaliza mpaka kanarudi. So afadhali iwe declared that Kenya is
Alcohol free.
alcohol free, and if you are caught with alcohol, you are considered as a criminal.
Right. That is what the panelists are saying here tonight. I don't know what you have as your point of view there at home watching this program, because it's a conversation for all of us. It's not going to be left for the government, not for the church, not for the medical practitioners. It's all us to bring our heads together, come on the table, have a chat, discuss, have it as a national debate, and find a way forward. That is what we will try to do as CAC TV, to try to bring this as a platform that we can have this chat and find a way forward. And of course, as the PCA Church as well, during the Health Week. Remember that you can follow us on our social media, CAC TV Kenya, on Facebook, CAC TV _ Kenya on Twitter, or formerly Twitter, X nowadays. And our SMS number 011-2200-044. You'll be able to see what we're saying and try to find a solution. If you have a story that you can tell, that you were in a den someday, but now you're doing well, you're flourishing, we are also willing to tell your story, because that way we're going to turn around the society. I don't want to add anything. My name has been Vincent Kerosi. I wish you a good night, even as we watch this show. See you again next time as we continue to have this conversation. For now, say good night, goodbye.